Hi and welcome back to my channel. In today's video I'm going to be talking about Sanchasan and its application to treat lower back pain and sciatica. If you've been following this channel for some time, you've probably heard me talk about Sanchasan before. This is because this is one of my favorite Master Tung points, and it was also one of the favorite points from Dr. Young, one of the teachers that I've followed more closely from Master Tung. And I've actually made a video about Dr. Young when he passed away, and I talked again about Sanchasan. But today I'm going to be talking about a different application of this point, or a reasoning for the use of this point that maybe you never thought about. And the application that I want to talk about for Sanchasan is treating lower back pain, but even more specifically sciatica pain from the sacrum area all the way down to the side of the hip and to the leg. But first let's analyze Sanchasan, where it is, and why is it a point that's so special. Come with me. So, as you probably already know, Sanchasan is in the area number 22, so it's in the hand, and it is located here between the 4th and 5th metacarpal joints of the hand. And this point, not to be confused with the Bashir points, it is needled this way, so it goes inside the hand, and it will usually go at least 2 centimeters in. This, if you're not used to this point, might seem strange, but it's not painful, and it's the correct way to needle this point. But what makes this point so special? First, let's forget Master Tung and just think about the location of this point according to a TCM and balance method reasoning. So what channels do we have? Well, if you think about the way Sanchasan is needled inside of the hand, it crosses multiple channels. So we can say that it belongs to the triple warmer channel, because it crosses the triple warmer, right? It goes like this. But if you think about what happens when you needle the small intestine channel that you have here, the small intestine, when you needle the channel, you will go like this. So if you needled, for instance, small intestine 3, you're going towards the path that you're going through with Sanchasan. So you also get an effect over the small intestine channel. And on the opposite side of the hand, you'll have also the heart channel. So when needling Sanchasan, you're at the same time working the small intestine, the triple warmer, and the heart channels, which is by itself an amazing application. You can add to this that it has the changing of the kidney, according to Master Tung's theory. So, at the same time, you're treating the meridians of the triple warmer, the small intestine and the heart, and the changing of the kidney. So, as you see, we already have a lot of possible applications for this point. I've told you in previous videos that this is an amazing point to strengthen the kidney, because you have the changing of the kidney. You're also treating the meridians of the triple warmer and the heart, which according to the balance method both treat the kidney. And the way you're needling this point, coming from the outside and going deep within the hand, coming from the yang to the yin, from the outside to the inside, it all points towards treating the kidney. It's also a point that's located in between joints and bones. So again, according to the tissue, it's great to treat the kidney. But why is this point so great to treat the specific kind of pain that I was talking about? If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses I teach the balance method to treat pain. This is a technique where you get instant relief in most pain cases, so if you want to learn about it, check them out. As I said in the beginning of the video, with Sanchasan, you can treat lower back and sacral pain, but you can especially treat pain that radiates from the sacral area to the hip and down like a sciatica, and this can be either through the gallbladder meridian or even through the bladder meridians. And why is this? Again, let's look at Sanchasan. We have already thought about the channels and the shenjing, but now let's think about the image. You know that we can image the leg over the arm, right? So the knee would be the elbow, and around the wrist and the hand we would have the hip and the lower back. So if you think about what you're doing when you're kneeling Sanchasan, you're coming this way. So if this is our image, what you're doing when you kneel Sanchasan is you're covering all this area. And not only are we respecting the image, but we're respecting the channels. So we're using the small intestine to balance the bladder, we're using the triple warmer to balance the gallbladder, and we're triply treating the kidney. Why is that? The triple warmer treats the kidney, the heart treats the kidney, and we're also having the shenjing of the kidney. And as we know, most cases of lower back pain will have an affection of the kidney too. And over that, usually when you're treating pain like this, you're treating pain that's related to the spine, you might be treating pain that's related to the hip, and you're treating pain that's related to a nerve, because this is the sciatic nerve. Well, when you needle Sanchasan deep within the hand, you're going between bone, between cartilage, and close to tendons. So all of this makes this point amazing to treat this kind of pain. I like to use this point contralateral to the pain, and in most cases we get great results. With this, I'm not saying that this point will solve by itself all of the kinds of sciatica and will treat every kind of hip or lower back pain, but when you have a case of lower back pain close to the sacrum, especially with sciatica, think about Sanchasan. This will be a great addition to your treatments. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel, and I'll see you in the next one.